echo assessment on you today. It'd probably take me about, I don't know, 5 to 10 minutes, if that's okay with you. Okay, can I check your name and your date of birth? Yep. Okay. So tell me your name and date of birth, please.
July 31st, 2000.
Wonderful. Okay, so Emily, I'm just gonna kind of have you sit back for me, okay? Now, I already did Glasgow Coma Scale. She opened up her eyes, she talked to me, she moved. So that's a what on a Glasgow Coma Scale?
15.
15, good job, okay. So, I don't see any lumps or any oozing sores, anything like that, so I'm choosing not to use gloves, okay? So I'm gonna start up here, I'm gonna touch your head, Emily. Tell me if you feel any discomfort, any problems with your hair, your scalp, anything like that. Okay, that looks good. And since I'm right up here, I'm gonna check our ears. So I'm palpating any redness that I see, no redness, any tenderness. Emily, any tenderness? Turn towards me, please. So I'm palpating the auricle or the pinna, the tragus. I don't see any drainage, I don't see any redness. Now I'm just kind of looking at her face for symmetry. She's nice and symmetrical, her eyebrows look good, eyelashes are out, both upper and lower, her sclera looks good. I'm gonna pull down on her eyes and look at her conjunctivae, it's nice and pink. Now while I'm right here, I'm gonna have her look straight ahead, I'm gonna do Perla. And this is bright in here, guys. So if that's in your room and you can't see those pupils constrict, make your room a little darker, okay? Appropriate lighting. So pupils are equally round and reactive to light. Okay, now I'm going to check for accommodation. To look at the ceiling, I'm looking to see if her eyes diverge and dilate. And now would you look at my pen? Now they're going to converge and constrict. Good job. Okay, I'm looking at her nose. It's nice and symmetrical. Can you put your finger on your nose and suck it? And the other side. Good. Her lips look nice and moist. Good color. Open up your mouth for me. I'm looking at her teeth. Close your teeth for me. Good. Smile. Puff out your cheeks. Raise your eyebrows. Frown for me. So facial nerve 7 is intact. You can put on gloves if you want to on this, but I don't plan on sticking my hand in her mouth. Okay, so I'm just going to look at your mucosa, nice and pink and moist. Her hard and soft palate look good. Lift up your tongue for me. Stick out your tongue, go side to side. Good job. Now I'm going to make you kind of gag. Open up. Say, ah. Throat looks good. Uvula looks good. Okay. Okay, so I'm moving down. I'm going to check lymph nodes. Supraclavicular lymph nodes. That looks great. Okay, now you can choose to do extremities or you can just keep on going down. Remember, you want to expose skin. Every place that you look for skin. I would also be going under her gown to listen to all these things. And then just for the sake of time, guys, I'm going to show you lung sound landmarks, but I'm not going to listen to every one of them. I'm just going to walk you through them. So Miss Emily, I'm going to listen to your lungs. Inhale and exhale. Okay, and she would truly do that. But I'm going to listen here and here, here, and here. I'm going to go down. She can move her breast herself, or I can use the back of my hand. You okay if I touch you? Okay. And here, and there. And I'm going to go under, and side, and side. And I'm going to listen to her heart sounds. I would have already taken her vital signs if her radial pulse was irregular, and I'm just going to say it was. So I have to listen to her apical heart rate for 1 full minute, okay? All right. So I would listen to the apical heart rate, midclavicular, fifth intercostal space, 1 full minute. Oh, you got a nice strong heartbeat. Okay, now I'm going to listen to her heart sounds. Second intercostal space on the right, aortic. You can use your bell with this or your diaphragm, whichever you can hear better with. Second intercostal space, pulmonic. I would still be underneath your clothes. Third intercostal space, Erb's point. Fourth intercostal space, tricuspid. Then once again, mitral or apical, fifth intercostal space. That looks good. Okay. I would have inspected her skin all along. Everything I expose, I'm inspecting skin, guys. So tummy, I'm going to lift up her gown to here, close our blanket down to here. I'm going to look at her stomach. Remember now, I'm going to auscultate first, all 4 quadrants under her clothes. If I didn't hear bowel sounds, I would listen for a full 5 minutes. That sounds good. I'm going to touch on your belly. Is that okay with you? Okay. Light palpation. Any tenderness, any pain when I do that? Now deep palpation. You still doing good, Emily? Okay. Now I'm going to do her arms, assessing the skin once again. So I'd be under clothes. I'm going to check her cap refill on her fingers. I don't notice any edema, no problems with the skin. I'm going to check her radial pulses bilaterally. Squeeze my fingers. Muscle strength equal bilaterally. You just kind of move around a little bit. There you go. Okay, can you move your legs for me? Checking range of motion. Looking at skin again, taking off socks, looking between toes, under toes, down here, looking at heels. That all looks good. Checking for edema. Checking pedal pulses bilaterally, equal bilaterally, and I'm going to stand this way. Checking strengths. Can you push against my foot? Can you pull them towards your head? Strengths are equal bilaterally. Cap refill under her socks. I would have those off, of course. Checking cap refill. That looks good. How you doing? Good. Can you swing your legs this way? I would stand by her just to make sure she's nice and steady. All right. So I'm going to go to the back. Are you okay if I raise the bed a little bit? Yeah. Okay. And she's nice and steady, so I'm not worried about that. So I'm going to check and look at her skin, looking at her spine. I don't see any problems. I'm going to check chest expansion. Can you take a deep breath? Good. And tactile fremitus, can you say 99?
99,
99.
99.
Good job. That also looks good. Feels good. Good vibration. So I'm listening to lung sounds. And you guys, you can't hear over the scapula, so you go kind of around the scapula. It's kind of your landmarks. Good job. Okay. All right, Miss Emily, I'm going to stand up with you. Just hang on, let me lower the bed again. You okay in your socks? I would make sure she had on non-skin socks. Okay. Stand up for me. Can you walk that way a little bit? I'm assessing gait. Turn around. Can you walk towards me on your tippy toes? Good. Turn around, walk that way on your heels. Good job. Turn towards me. Can you do a knee bend? Good. Can you bend over and touch your toes? Assessing spine, range of motion. That all looks really good. Now I'm going to check cerebellar function. Can you do this? Touch your nose. Close your eyes. Good. Can you do this? And you guys can choose to do any of these. Okay. Can you do this? Good job. Okay, now this is called a Romberg. Stand towards me. Put your feet like this and stand like this. You want to stand by your patient when you do this in case they have a positive Romberg. Close your eyes. So that's a negative because she hasn't lost her balance. That's really good. Now can you walk back and sit on the bed, please? And lay back down. And one last thing with cerebellar function, can you touch your heel to your shin and go up and down? And the other side with your heel.
Oh, sorry.
There you go. Okay. Do you have any concerns? Any questions? You look pretty healthy. Thank you very much.
You didn't look at my butt.
Yeah, but you stood up and your gown flapped open.